Welcome to Fort Irwin, California in the Exceptional Family Member Program, or EFMP, at Weed Army Community Hospital. The nature of care provided at Weed Army Community Hospital focuses on primary care, limited specialty care, as well as emergency room services. Weed Army Community Hospital has a total of 15 primary care providers, 11 specialty care providers, and 8 behavioral health providers. The specialty services include general surgery, orthopedics, pediatrics, obstetrics and gynecology, physical therapy, nutrition, and optometry. The clinical laboratory, radiology department, and pharmacy service furnish necessary support activities, all of which result in comprehensive primary care. Patients requiring a higher level of specialty care are referred to other military or civilian treatment facilities if necessary. The minimum distance to such care is 74 miles, which is not reimbursable, but more commonly the distance is 113 or 217 miles. Please keep in mind these distances are all one way. Because of the distance to and from specialized medical care, it is often difficult or impossible to follow through with scheduled appointments. Obviously, this can impact on the effectiveness of medical care. In addition, the cost of travel places a financial burden on many families. What is the Exceptional Family Member Program? EFMP is a mandatory enrollment program that works with other military and civilian agencies to provide comprehensive and coordinated medical, educational, housing, community support, and personnel services to families with special needs. An exceptional family member is any active duty family member who requires more support than normally provided by a family practitioner in an outpatient clinic setting or receives any special education services. There are over 100,000 military families with special needs. Enrollment in EFMP does not adversely affect selection for promotion, schools, or assignment. Information concerning enrollment in EFMP or any of the data used in the program is not available to selection boards. The criteria for identifying a family member with special needs is outlined in Army Regulations 608-75 Appendix B. The top 10 qualifying diagnoses at Fort Irwin are asthma, this is the #1 medical enrolling condition, depression, attention deficit hyperactivity disorder or ADHD, allergic rhinitis, diabetes, anxiety, hypertension, migraine, epilepsy, and autism. Special education needs are only considered in assignments outside the United States. CONUS assignments are not based on the educational needs of children. Every local school system must comply with public laws regarding the provision of special education. You should hand carry all educational records, including individual education plans or IEPs, with you. Do not ship them in household goods and do not rely on them to be forwarded by a school. Enrollment in the Exceptional Family Member Program should be made as soon as a special need is identified. Enrollment must be completed before the soldier is on levy in order for the program to work. Please get enrolled before coming to Fort Irwin. Enrollment allows assignment managers at Army personnel agencies to consider the documented medical and education needs of exceptional family members in the assignment process. When possible, soldiers are assigned to an area where medical and special education needs of exceptional family members can be met. This will depend on a valid personnel requirement for the soldier's grade, specialty, and eligibility for the tour. All soldiers are still eligible for worldwide assignment. What is the EFMP enrollment process? The soldier or family member should contact the nearest military treatment facility, EFMP point of contact, to obtain the enrollment forms and begin the assessment process. The soldier is responsible for updating the enrollment every 3 years or as conditions change. Additionally, the soldier must terminate enrollment in the program if they have disenrolled their family member from VEERS due to death or divorce. Weed Army Community Hospital, Fort Irwin, welcomes you and looks forward to assisting with any EFMP needs or concerns.